All right, welcome everybody to our Friday edition of Tim at 10. This is something that our first Friday edition where we're going to do our director week in review and frequently asked questions that I have received over the last week. How's your week been? Here we are. The dog days of summer are here. It's hot outside. We've got a lot of new information about COVID and new mandates and regulations and recommendations and considerations and all of these new fabulous words that we continue to learn as we go through this transition of COVID-19. But there's a lot that we need to talk about today that I've got on our agenda. Again, if you have any questions throughout the Facebook Live today, be sure to ask your question in the comment screen, and hopefully I will be able to get to those and we can talk about these items. I basically have 4 things on my list to talk about today. We're going to talk about the second edition to the proposed minimum standards that we received a couple of weeks ago. All of that came from Senate Bill 568, so shouldn't have been a surprise to anyone that keeps up with legislation. I'm going to go over those changes. It's not a whole lot. And then we're going to talk about the Texas Education Agency and their guidelines that were released this week for children to return to public school, and what that's going to do to our after-school programs and how we're going to operate our after-school programs moving forward. We're going to talk about masks and the executive order that was issued by Governor Abbott last Friday and how that is affecting our licensed child care facilities. And of course, we got to talk about COVID, right? It wouldn't be a webinar if we didn't talk about COVID. So that's what I've got on my agenda. Anything else that y'all want to talk about, we can definitely try to get that in the time that we are together today. All right. So the first thing that I wanted to talk about, again, is the proposed changes to the child care minimum standards. And you may have noticed in the email that we received from Health and Human Services is that it said informal comment period for the proposed rule changes. That's basically because this was a piece of legislation that was passed by our legislators and signed by our governor. Child care licensing is required to put these changes into the standards. So it's going to happen no matter what comments you give, all right? And those of you that attended my weekend mini conference or my Director Credential course or my Director 2.0 course in the fall of 2019, we went over 8 different pieces of legislation that's going to have an impact on our licensed programs. Senate Bill 568 was one of the big pieces of legislation that raised a lot of concern for people because it required a lot of parent notification. It required liability insurance to be, covered by the school. Parent notification if you don't have liability insurance. But the biggest concern that a lot of folks had with Senate Bill 568 is that it is going to increase the administrative penalties if you have a situation with abuse allegations or if you have situations with infant sleep safety violations. There's some pretty steep administrative penalties that are going to be added onto your program with Senate Bill 568. All right. So, a couple of weeks ago, we did a webinar and we talked about Senate Bill 952. 952 was about physical activity, screen time, and nutrition. So if you did not get to catch that webinar, it's on my website, timthetrainer.com, or you can just scroll back through Facebook and you can probably find it on there. But it is on my website under online trainings. I got a lot of questions on why are we getting a second email from child care regulations about these updates? Why didn't they just tell us about all of the updates at one time? Well, it's because they're different pieces of legislation and they're kind of tackling this one at a time. This should be it, all right? This should be it. we do have House Bill 1849 that was also passed by our legislators that had to do with writing a policy on EpiPens. We have not seen anything from child care regulations just yet about House Bill 1849, so we might see one more thing come up, from them on that. But that one really wasn't that big of a deal. House Bill 1849 just basically said you may create a policy on administering EpiPens or having a generic EpiPen in stock. But it applied to licensed child care programs, shopping centers, amusement parks. It was a very broad piece of legislation. Haven't seen anything about that yet, but I'm sure we will. So let's talk about Senate Bill 568 and the email that we got from Child Care Regulations, because, they have a new name now. Did y'all see that this week? It's no longer Child Care Licensing. They are now called Child Care Regulation. Okay, whatever makes them happy. So, with the proposed changes that you saw, the first big piece is insurance. And of course, you're required to carry a minimum of $300,000 in liability insurance. That has always been around, no change right there. But basically what you're going to see is 746-203 that they're adding to the standards about maintaining that level of liability insurance. And if you are not able to carry $300,000 in liability insurance, then you must notify parents of that. And it kind of outlines a couple of different situations on when you cannot carry $300,000 in liability insurance, such as you can't afford it, or you've exhausted your benefits. That was the one thing that caught my eye right there, because you might have a situation where you've got liability insurance, but you've had a few claims and you've exhausted your benefits. You would need to notify parents and licensing of those type of situations. So, again, that one is pretty easy breezy. I hope all of you that are running high quality early education programs and after school programs, you have much more than $300,000 in liability insurance. I always recommend a minimum of $2 million in liability insurance, but licensing is just going to tell you $300,000. All right, so the next thing is 746-305, and it's going to talk about what other situations must you notify child care licensing. All right, well, this is all about illness exclusion. Now, the one big takeaway that I got from this change, and again, those of you that have taken my director credential course, I always point this out in my credential course when we do our review of minimum standards. But in the past, it's always said, what situations must you notify licensing? And it says when the child requires medical treatment from a healthcare professional. But then when you look at when do you notify the parent, it says when the child requires medical attention. And we've always talked about the difference between those two standards. One says medical treatment, one says medical attention. And so there's always been this interpretation issue of what is the difference between attention and treatment. Well, you're going to notice with these changes that they both will now say medical treatment, all right? And medical treatment is when the healthcare professional actually does something to the child. So they dig the rock out of the ear, or they stitch up the cut, or they put a cast on the broken bone. That's all treatment right there. Attention is when the doctor just examines the child and says, they're fine, go on your way. The other big takeaway I noticed with 746-305 is that they're adding in here that you must notify licensing if the child in your care shows signs or symptoms of an illness that requires hospitalization. All right? So I thought that was really good clarification. So not just an injury, but illnesses that require the child to be, in the hospital. So you're going to see that right there, and I'm sure we're going to get more guidance and clarification from licensing once that we get further into this process. All right. Same thing with notifying parents. They're using the word medical treatment. And again, they're adding showing signs and symptoms of an illness that requires hospitalization. That's being added in there as well. All right. Then we're going to go into what's going to be 746.309 and notification requirements when licensing finds your center deficient in standards related to infant sleep safety and child abuse, neglect, and exploitation. So basically, if you are being investigated by child care licensing, there's going to be requirements that you notify the parents of the allegation. All right? This is kind of scary. All right? This is pretty scary right here. That, a parent comes and says, well, my 2-year-old came home last night and said the teacher hit him. That's something that you have to investigate, report to licensing, and now they're stating that you would have to report that to all of the parents in your program. Everyone breathe on this one. Take a deep breath. All right. I think there's going to be a lot of interpretation issues with this particular standard. So we're going to have to wait for some really good, clear guidance from licensing on what this is going to look like. My thought right now is that you don't do anything until you're told by licensing to do it. All right. So that's kind of my take on it at this point. But it kind of outlines under the 746.309, the new 746.309, what that is going to look like with the notification. All right. And same thing with any violation due to infant sleep safety guidelines. So if you are cited for an infant sleeping on their stomach, or you're cited for an object being in the crib, a child sleeping in a bouncy seat, a child sleeping in a swing, these are all violations of the infant sleep safety guidelines. You would be required to notify your parents that you received that deficiency. All right. So I foresee us doing a lot more training and coaching our infant teachers on infant sleep safety guidelines, because if they drop the ball and you get a deficiency, it's going to have a huge impact on your entire business. All right. So a lot of pressure there for your infant teachers. Okay. It goes on, the new 746.701, again, it's just going to talk about record of accidents and incidents, and they, once again, are just adding in illnesses or injuries that require medical treatment by a healthcare professional or hospitalization, all right? So they're really, really tracking when a child has to be admitted into the hospital. That's what you're seeing right there. With the new 746.801, when it talks about record keeping, basically proof of your liability insurance, that's nothing really new right there. They just changed the words around. And then you're going to see added to the required documents that you have in your program, number 22, which is going to be proof that you have notified parents in writing of a deficiency on infant sleep safety practices or child abuse, neglect, or exploitation. So you've got to be able to prove to licensing that you notified your parent of that deficiency. All right. When we go to 746.3605, this is going to be about illness exclusion, but it's going to talk about how do you respond to a child whenever they become ill. Basically, it's kind of the same thing that was in there before, but they're adding the words, a child becomes ill in your program, but does not require, immediate treatment by a healthcare professional or hospitalization. And then it's basically the same list that we've had in there all along. All right. So that is basically it with the additional rule changes from child care licensing. Pretty easy breezy. It should not have been a surprise to anyone if you're keeping up with this stuff. But like I said, the fines and the administrative penalties that you will be assessed with abuse allegations and with infant sleep safety violations. That's going to be pretty tough on a lot of folks right there. All right. Let's move on now, unless anyone has any questions about the standards. Let's move on now to the Texas Education Agency and the documents that were released this week by TEA. It's the TEA Comprehensive Guidelines for a Safe Return to On-Campus Instruction for the 2020-2021 school year. And I'm sure y'all have seen this in the news. I'm sure you've seen it on social media. If not, you can just go to the Texas Education Agency website and you can download it. It's right there on the front page. All right, so here's the deal with this is, we've heard a lot of rumors over the last few months about what school districts are going to be doing with school in this upcoming school year. And we've heard all these rumors about A/B schedules and kids only going 2 or 3 days a week. And, we could write a book on all of the different rumors that we've heard. Well, and I do know that there were some school districts that jumped the gun. All right. They jumped the gun and they kind of issued a plan before they were given guidance by TEA. So if you're in an area where your school district has already issued their plan to reopen in August, you might see some backpedaling, all right? And you might see them retract that plan so that it matches what the TEA has issued. I've already seen that in a couple of school districts that had to kind of say, well, just kidding. Now here's our plan, all right? So I'm actually really happy with this because it is going to put everybody on the same course. So all of the school districts are going to be having the same guidelines. You're not going to have a big mixed bag of nuts where this school district is doing one thing and this one's doing another thing. And those of you that do have, large after-school programs, you may service 2 or 3 different school districts depending on your area. And we always know that that's very difficult when each school district is kind of doing their own thing, especially when it comes to calendars and days off and in-service days. It gets a little crazy for us. But when it comes to returning to school this fall, they all have to follow these TEA guidelines that were released. So basically, here's what it says. It says, on-campus learning will be available for all children, and the children will go 5 days a week, 8 to 3 or whatever the time frame is, but they're going to be returning to school like normal, all right? So that's option number 1, is that they can return to the classroom just like normal. Option 2 is that families will have the choice to be able to choose remote learning, all right? And kids will be able to log in and have their little laptop and do remote learning, all right? Now, the thing about the remote learning, when you read these guidelines, it's not going to be the way it was back in April and May, where the kids kind of did their work whenever, and there was no accountability. Some showed up, some didn't show up, some did their stuff, some didn't do their stuff. I've got a lot of friends that are public school teachers, and they were so frustrated and stressed over the remote learning back in April and May because there was no accountability with what was going on. That's going to be very different based on these guidelines that were released. The children that choose, or the families that choose remote learning, they will be held accountable for the child's attendance and participation. The child will be required to be logged in during certain times of the day. And the big takeaway that I took from this is that even the children with remote learning will be returning to the standard grading system. So it's no longer going to be the pass-fail, if you logged in, you pass, type thing that was going on at the end of this past school year. They're returning to the regular grading system. All right. And parents will be able to make the choice to do remote learning every 9 weeks. All right. So they're going to be making a commitment to return to the classroom or do remote learning every 9 weeks. After 9 weeks, the parent can make a new commitment. They can either go to the classroom or they can continue with remote learning. And it's going to be that way through the school year. That way, if a parent does not feel safe sending their child to the public classroom and then conditions improve, all right, things get better, things get safer, they can send their child to the classroom at the end of that 9 weeks, all right? So we're going to see this cycle every 9 weeks of what's going on with the kids in the classroom. Now, what is that going to do to your program? How is this going to affect your after-school programs in your centers? Well, and that's what Renee just asked, the very big question right here. Are you going to provide services to help with virtual learning? You're going to get to make that decision, all right? And I know that me and my team, we have talked about this a lot this week. It has been a very, very hot topic of conversation. How involved do you want to get with remote learning and supporting these kids? Now, conversation number one is if a family does not feel safe sending their child to a public classroom, why would they feel safe sending them to us? All right, so what's the difference between the health and safety of the public school classroom versus our program? And you would think that if they don't feel safe sending the child to the public school classroom, why would they send them to us? All right, so you got to ask the question, will we even have the opportunity to assist the children with remote learning? Because if that's the reason why the parent is choosing remote learning, they're probably not going to send the kid to our programs. But there might be other reasons why they're choosing to do remote learning. And depending on that other reason, you may have a situation where you've got children that want to come in to your program. You're going to get to make this decision. Now, typically during the school year, our after-school programs are closed from 8 to 3. You don't have staff in that classroom. So if you do choose to support remote learning, you're going to have staff to accommodate that. All right? That's going to increase your operating cost right there. So my whole thought on this is that if you choose to support remote learning and do remote learning assistance, my suggestion is to charge a premium fee for this. All right, the parents are going to have to pay a little bit extra for you to have that child all day long. And my advice is for you to create a pretty structured schedule that would require that child to do their remote learning. It would not be like your normal after-school program where they just play and run and do their thing, but they're going to have to be on that laptop according to these guidelines. Now, I already had one person ask the question, well, what about child care licensing and the regulations on screen time? Well, if you remember in the proposed rule changes that we saw last month, they did state that children doing their homework or their schoolwork does not count as screen time. So that eliminates that question right there. I want to go back to the parents that don't feel safe sending their child to a public school classroom. I don't know how many of y'all have downloaded and read the CDC guidelines for reopening public schools. It's about 7 or 8 pages here of the CDC guidelines for reopening schools. You know what? It's almost identical to the guidelines that we're having to follow from the CDC. almost identical. So the steps that the public schools are taking to maintain a healthy environment are pretty much the exact same steps that we're doing right now. They're going to be screening kids when they come in the front door. They're going to have an enhanced exclusion policy for illnesses. All of the things that we're doing right now is what's going to be going on in the public schools. So I thought that was interesting too. I did have a question. I saw Camellia did have a comment. Parents mentioned that public schools are bigger, so there's a higher risk of exposure when you have, 800 kids in one building. I do agree with that. And when we talk about reasons why parents may choose remote learning over, sending the child to the classroom, the number of children at an elementary school versus the number of children in our facilities could be a big factor. And I do agree with that comment that Camellia made, all right? One of the questions that I got earlier this week was that a particular director told me that parents are telling them one of the reasons why they don't want to send their child back to public school is because they don't want their child to wear a mask all day long, all right? So I did a little bit of digging into that, all right? Okay, I saw a question there from Catherine. I'm going to get to that in just a second, Catherine. It's a very, no, that's actually a really easy question to answer right there. Catherine just asked, she can't get a clear answer from her licensing rep regarding ratios and provider numbers. I can give you an answer. It's the normal child-staff ratios that are in our minimum standards that have been around since 2003. There are no changes to the ratios or group sizes right now. The ratios and group sizes that were listed in the governor's health protocol are recommendations. You cannot be cited for not following those ratios. And child care licensing actually sent out an email a couple of months ago when that governor's health protocol came out, and they even stated you will not be cited for that. So I can give you that answer right there. Okay, let's get back to public schools and masks, okay? With the public schools and the mask, and this is outlined in this TEA comprehensive guidelines for a safe return to on-campus instructions. As long as there is an executive order requiring face coverings, then the children and the teachers at the public schools would be required to have the face coverings. If the executive order expires and the governor does not reissue a new executive order, then they would no longer require face coverings. All right? So with the parents that are having the concern about children having to wear face coverings all day long, it's basically based on the executive order that we got last Friday from the governor. Now, as soon as that executive order expires, no more face coverings unless he issues another one. All right? So let's go ahead and talk about face coverings in our licensed child care programs. All right? Now, this got a little complicated because we started seeing counties issue their own orders. So like where I'm at, I had Dallas County and Tarrant County issue orders for face coverings. And then on Friday, it went statewide. And there's a little bit of some discrepancies between what the state issued versus what some of the different counties issued. Bottom line is the one consistent item is that children under the age of 2 should not have face coverings on. All right, that's been consistent across the board. The big question is children over the age of 2. Now, the state order states any individual over the age of 10 must have a face covering on. All right, so where we're getting a lot of discrepancies and interpretation issues are the children between the ages of 2 to 10. And where is that line? Well, when you read the CDC guidelines and when you read the state order, it says that face coverings must be worn when feasible and when physical distancing of 6 feet or more is not possible. Okay, so those are big words right there. Those are key words right there. When it's not feasible to wear a face covering, then it's not required. When there's not an opportunity to stay 6 feet apart, then that's when it's required. All right. Now, in our classrooms, we want our teachers to be within 6 feet of the children. They need to interact, they need to engage, they need to connect. So, the teachers need to be wearing their face coverings, while they're in the classroom. Here's the bottom line. It's not feasible for a 2 or 3-year-old to keep a face covering on. Come on. All right. This should be common sense for anyone that works in early education or knows anything about early education. You cannot expect a 2, 3, 4-year-old to keep a face covering on. Now, I had a conversation with licensing a couple of days ago on Wednesday. I sent an email to the state office to licensing and said, hey, we're getting a lot of different guidance out there. We have different licensing reps saying all kinds of different things about face coverings and children. I got a phone call from licensing that basically said, this was how the phone call went. An email just went out to every licensing rep in the state of Texas about 10 minutes ago. This was on Wednesday, okay? An email just went out about 10 minutes ago to every licensing rep in the state of Texas. Number one, no licensing rep should be giving any guidance on face masks for children, period. All right? They said that child care licensing and the Health and Human Services has not come up with their guidelines on children with face masks yet. All right? They are still working on that. So no licensing rep should be giving any guidance on face masks for young children. And number two, no one is going to be cited for this. All right? So if you have a licensing rep that is telling you you're going to get cited if the children do not have on face masks, that licensing rep is not saying the right thing. All right? So hopefully after Wednesday, when this email went out to all of the licensing reps, hopefully that kind of cleared a lot of things up. Now, they did tell me that they are working on guidance for the face mask. We should be getting that sometime soon. They could not tell me when it was going out. I'm sure that their attorneys are working on this, and they have to be very, very careful with the guidance that they give. There's a lot of liability right here. So they have to be very careful how they give that guidance. So there's the whole deal with the children in the face mask. I will tell you, in my programs, we are requiring our employees to wear face masks when feasible and when social distancing is not possible. I am having them sign a face mask agreement, and you can find that agreement on my website, timthetrainer.com. Go to documents, and you can see that. A face shield is an acceptable face covering. So I've actually gotten that question a lot this week. Face shields are acceptable face coverings, so you can do that instead of a face mask. Now, for the children, what we're telling parents is that if a parent wants to send in a mask for their child, they are more than welcome to do so, and we will do our best to keep that on them. But if we're not going to shame the child or make them feel indifferent for not wearing that mask. I'm just reading a question right here. About dual language. I got a question about if you have a school district, I guess, that has dual language and you have someone that is fluent in Spanish, which some of you don't have, you're just going to do the best you can right there. Hey, this is a great opportunity for us to learn a new language, right? I had a conversation with someone yesterday about that, with the remote learning, and is it going to be difficult to assist the children with remote learning when, the curriculum and the guidance from different school districts are going to be a little bit different? Here's what I'm going to recommend on that, all right? You're going to draft a policy that you're going to have parents sign off on. If you choose to do remote learning assistance, I'm going to recommend that you draft a policy that parents sign off on that says you will provide time and space for children to do remote learning. You'll have an employee there to assist, but you are not responsible for the outcome. All right? Our program will not be held responsible for the child's grades or the outcome of the remote learning. We're just there to assist the child and make sure that they're doing their schoolwork. But you're going to draft a policy and have the parents sign off on that. I'm working on that as we speak right now and getting the wording down. All right. So, I saw someone said that their video is going in and out. This is being recorded, so if you missed anything, it'll be posted on my website later on today. So I apologize for technical issues. Sometimes the internet gods have different plans for us than we do. But this is being recorded on a different device than Facebook Live, and so you'll be able to go back and watch that. All right, I'm just kind of scrolling back to make sure I didn't miss any other questions. Yeah, with the public schools don't have hand washing sinks as easily available as we do. I completely understand that type of concern as well. I got a question about a name of a company that provides service to disinfect the whole school. I don't have a company that I can refer you to that comes in and does your disinfecting. I'm going to be really honest with y'all. I kind of have a problem hiring and paying a lot of money to a company that will come in and do what my staff should already be doing. Your staff should already be sanitizing and disinfecting your classrooms and your program. If you do need to have a deep clean, they're more than capable of doing that. I honestly don't see a reason why you should hire a company to do what your people should already be doing. So that's kind of my take on that. So I'm reading a question right here that on the ratios and group sizes, with the governor's health protocol and the CDC guidelines, what the executive order that we have in place, or the emergency order that we have in place right now, is that there are a few items with childcare regulations that we have to follow, nothing more than what we've been doing since April. But then it says that you have to follow the CDC guidelines. The CDC guidelines do not say, they do not outline any specific ratio or group sizes. The governor's health protocol is the one that outlined recommended ratio and group sizes, but you're not required to follow those health protocols. They are just recommendations. All right. Now, my recommendation to you is that you follow them the best you can. All right. I mentioned this in a lot of my trainings. I always say this in my director credential course. I say this all the time. When you're making a decision in your program, always ask yourself, how would a jury perceive this decision? All right. So if I was drug into a courtroom, or if you were drug into a courtroom, and all of this evidence was being presented, how would a jury perceive that information? Now, you've got CDC guidelines, you have child care licensing and health and human services guidelines, you have the governor's health protocol, you've got a lot of different documents that are giving you guidance. And when you say, well, I didn't follow the governor's health protocols because it wasn't required, how is a jury going to take that? All right? So my advice is to do the best you can and follow the best that you can on that. All right. So the last thing that I wanted to talk about that I've got on my list right there, right here, is screening. Now, we've talked in the past about parents and employees signing a disclosure and acknowledgement statement that basically states that they are following all of the local, county, and state guidelines for COVID-19, and that if they do come into contact with anyone that has signs and symptoms, or they come into contact with someone who has been tested positive, that they have to notify you immediately. A lot of you are having folks sign these disclosure and acknowledgement statements. I decided this past week to take it one step further. I'm just going to be very honest with what I'm about to say, and it's going to be pretty blunt, but we have parents and employees that are not being honest with us. All right? I don't like to use the word lie. I think when you say someone is lying, that's pretty harsh, and I don't normally like to use that word. But in this case, we got people lying to us, all right? That is not being honest with their activity outside of your program. So I went ahead and took it one step further and created a weekly screening questionnaire that I'm requiring families to fill out and sign every week, all right? Not just families, but employees too. That basically is asking them, in the past 7 days, have you had any of the symptoms? Have you or anyone in your household had any of the symptoms related to COVID? Have you or anyone in your household been exposed to someone with symptoms? Have you or anyone in your household been exposed to anyone that's been tested positive? And I'm having parents sign off on this every week. I know of a program in the North Texas area that has a positive case of COVID-19 right now. And long story short, the parent of the child tested positive for COVID and for a week was still bringing their child to the center and did not tell anyone that she had tested positive, and she was still bringing her child. That infuriates me, all right? And now the child has tested positive, and the entire toddler classroom is in quarantine, as well as the 2 teachers that work in that room. All because this selfish parent didn't tell anyone that she was positive and continued to bring her child to the program. I believe there should be some civil liability or criminal charges in situations like this, but I'm not a lawmaker and I don't get to make those decisions. But it is really crazy. And I've heard a couple of different stories about this. I heard a story about a parent that told the school that her child was positive with COVID-19. And long story short, the child wasn't positive. The parent didn't want to pay tuition. All right. And again, made up the story. So always make sure you're getting that documentation from the healthcare professional before you start opening all these cans of worms. But we're going to step it up and have parents sign weekly an agreement statement. And you can find that on my website, timthetrainer.com, under documents. I have that weekly family screening questionnaire. Letitia asked a very good question. Can you terminate care over that? Absolutely you can. And that's actually on the document that I created that's on my website. At the very bottom of the document, it says that if a parent falsifies, they will be permanently dismissed from the program. And I actually have that on that document. All right, so that's a good question. Ashley is saying that if you are on CCMS or you're on the child care subsidy system and you have someone that tests positive for COVID, that CCS will give some assistance for you. That's good to know right there. So thank you for that information, Ashley. That was very helpful. All right. So yes, do I have a copy of what I'm having staff and family sign? Yes, it's on my website, timthetrainer.com. Our friends down at Sweet Pea Learning Center is saying that she's having parents sign and fill out that acknowledgement every day. I think that's a great idea. If you want to go that far, the more documentation, the better. Absolutely. All right. All right. So I'm just kind of going through questions that are coming in right here too. Oh, Amber, thank you so much, Amber. You just reminded me of another very important thing that I wanted to talk about this week. Another issue that we're starting to see, and I'm just going to tell y'all, I don't know exactly how to guide you and coach you on this yet, all right? But one of the problems that we're starting to see is that families that are excluded from care because they have been exposed to someone or they have traveled outside of the country or whatever, and you have told this family you can't come for 14 days because of their situation, we're starting to see situations where these families are just going down the street and enrolling in another program. So they've been excluded from your program for 14 days, so they just go down the street and they enroll somewhere else. And you have no idea that they have been excluded from another program. We're starting to see this happen, all right? The only guidance that I can think of at this point, because they're probably going to fill out your disclosure and agreement statement and not be honest with you because they're already not being honest by going somewhere else when they've been excluded. The only guidance that I can think of right here is to have a 14-day waiting period anytime you enroll a new child. Now, that's going to be very difficult for your business, and that's going to be difficult for the parents. But to prevent parents from hopping from one center to another when they're excluded, that's the only thing I can think of is to have a 14-day waiting period before a new child starts. Hopefully, y'all haven't experienced this, but it's happening all over the state right there. All right. I see a lot of questions coming up from y'all about what to do when you have a positive case of COVID. This is probably the number one question that I get, and I get this question about 5 times a day from people. What do you do if you have a positive case of COVID? All right, there is no generic answer to this, all right? You're going to contact your local health department, and they will give you guidance. There's a lot of things that they're going to be looking at. They're going to be looking at the area that you're in, how many positive cases have been in your area. They're going to look at how long has the child or the employee had symptoms. They're going to look at the number of people they come into contact with. There's a whole list of things that they're going to look at, and then they will give you guidance based on all of those answers. They may require you to close. They may not require you to close. I've had 3 schools this week that have contacted me that were not required to close. From what I'm being told, it has to do with how long did the child have the symptoms or the employee have the symptoms, and it has something to do with the droplets in the air. It takes 24 hours for the droplets to land on a surface, and so that's a big determining factor on whether or not you close, is that time frame right there. That's kind of funny, Tracy. Your health department is closed due to COVID. That's ironic, isn't it, right there? I'm sure that they have another local health department that is supporting the phone calls and the guidance in that situation right there. So basically, if you do have a positive case, contact your local health department and follow their guidance. And I will tell you, and I think it's been hundreds of phone calls and emails that I've gotten since April with this situation. There's been no consistent answer, all right? Every single person I talk to, the guidance they're getting from their health department has been very, very different, all right? There's very little consistency because it's all handled on a case-by-case basis, all right? So we do have people that are not in the state of Texas that are on our Facebook Live right now. Welcome. Hi. Do we have a high number of cases in licensed child care centers right now? Yes, and the number of positive cases are growing. Now, the last report that I saw was a little over 1,300 positive cases in licensed child care centers. Now, here's where the media is doing their media thing. They're stating, and I'm just going to use 1,300 as an example, okay? It's not the exact number right now. I'm just using it as an example. But they're saying 1,300 positive cases in licensed child care programs. What they're not reporting is over 2/3 of those numbers are adults. Less than 1/3 of the positive cases in licensed child care centers are the children. And it's really interesting to me that they're saying the adults. That could be an employee, that could be a parent, and they're not being very specific on that. But it's less than 1/3 of those numbers are actual children, okay? And when you look at the fact that we have about 125,000 children in licensed child care programs in Texas, we're still looking at less than 0.5% that is testing positive. So, I think we're still doing a really good job of keeping everyone healthy and keeping our programs safe. But is there an increase in our numbers? Yes. But it's also because more children are coming back to care. So, we can play this game all day long on that one right there. All right. Yeah, some people are saying they had to put a hold on enrollment due to all of this. It just depends on your area. We got hot spots in certain parts of the state. Everyone is a little bit different due to what's going on. All right. I got a question from Amy about when an employee is out sick, are you required to pay them? All right, so this is going to go back to the Family First Act that was put into place on April 1st, and it's an extension of the Family Medical Leave Act. So according to the Family First Act that came out in April, if you have an employee that tests positive for COVID-19, or you have an employee that is required to quarantine based on recommendations from their healthcare professional, all right, then under the Family First Act, you would pay them for the first 2 weeks, all right? Now, you do get to, you're going to get that money back on your payroll taxes, and that's the way it's working, is that when you file your quarterly payroll taxes, you're going to get credit for that payment to those employees under the Family First Act, all right? But I would recommend with this question going back and reading up on the Family First Act. I can send you a link if you can't find it, but if you Google it, it's right there. But there you go. Now, again, I'm going to stress to you, documentation from the healthcare professional is going to be critical, that you get that documentation. If they can't provide you with documentation, then no payment, all right? You're not going to take their word for it. If you have an employee whose spouse tests positive, all right, get documentation that spouse is being required to quarantine with their positive spouse, all right? And then you can fall into that Family First Act right there. But there's a lot of things that you need to read up on that, before you start doing that. The great thing about it is that you do get credit with your payroll taxes, so it's not going to come completely out of your pocket. You do have to front the money, but you'll eventually get it back. All right? I got questions coming up about families that are traveling out of state and then wanting to come back to your program. This has been another really hot question here lately. Basically, what you're going to want to do right here is that you're going to look at the particular state that they're traveling to and how did they get there. Are they flying on a commercial airline, or are they driving in their personal car? That's a big factor, okay? If they're driving in their personal car, there's a lot less exposure. If they're on a commercial airline, you got a big risk right there. Also, what are they doing in the other state? Are they just visiting family and they're staying with just a small group of people? Or are they going to outings where they're out in public with a lot of people? Okay, those are things that you're going to look at. You're also going to look at each individual state and what are their travel restrictions. All right, there is a big long list of states that are on the CDC's website that are high-risk states. And the CDC is recommending 14-day quarantine for anyone that travels to these particular states. And that list changes daily, okay? But you're going to go to the CDC website and you can find that. And by the way, Texas is on the list. So we are on the naughty list right now when it comes to travel advisory, okay? So for those of you that are asking the questions, what about families that travel for family vacations or travel out of state? That's what you're going to look at. Are they going to a state that's on the high-risk list right now? How are they getting there and what are they doing? And then you can make a determination on whether you're going to require them to be excluded or not. All right? You have two staff members that say they were around someone who tested positive. No, you do not need to pay in that case. Very good question right there. Oh, yeah, I was around someone that tested positive. I need free pay. Nope, doesn't work that way. All right? That's why I want y'all to read the Families First Act because it's very, very specific on when you pay. And like I said earlier, never take their word for it. All right? You're going to get documentation from the healthcare professional that they are being required to quarantine. That's the key, that they are being required to quarantine. All right. There you go. It does not matter whether they're full-time or part-time. That is irrelevant. So that's a very good question from Julie. It does not matter whether they're full-time or part-time under the Families First Act. That's irrelevant. You're just going to look at, do they fall into the category of whether they get that payment. And like I said, you pay them for the first 2 weeks. If it goes on past 2 weeks, then it's a portion of their pay. And you're going to want to read the Families First Act to get that detail right there. If you have a child that is excluded from school due to COVID, can you accept that child in your licensed program? My thought on this is that if they're being excluded from public school, they need to be excluded from your program too. You know, this kind of goes back to prior to COVID-19, and I'm sure a lot of y'all have dealt with that issue of a kid that gets sent home from public school because they're sick and then the parent wants to bring them to us. No. If they get sent home sick from public school, they stay home and they don't come to us either. That's one of those things that should fall into common sense, right? But sometimes that common sense is not out there. All right, fantastic. We are out of time. It is almost 11 o'clock now, so that hour went really, really fast, and we covered a lot of really good stuff. So this was fun. I hope y'all enjoyed our Director Weekly review and frequently asked questions. We're going to do this. I can't do it every Friday, but I'm going to be doing it most Fridays. Some Fridays I have other obligations, and so I can't do a weekly review every Friday, but I do have this on my schedule quite often. Remember, I've got my entire Tim at 10 schedule posted on my website. So if you go to timthetrainer.com, you can check out upcoming topics that we're going to talk about at 10 o'clock on Mondays, Wednesdays, and Fridays when available. Otherwise, my weekend mini-conference schedule is posted on my website. We are going to be doing weekend mini-conferences virtually for the rest of the year. So you can catch that on Facebook Live. Our Director Credential course and our Director 2.0 course also will be either live in person or virtual, whatever you feel comfortable with, and that's all located on my website. I do have a class coming up in a week, so not next week, but the week after next. I have a director credential course. Like I said, you can either do it in person or you can do virtual, whatever you feel comfortable with. And so check that out on my website as well. I see a lot of other questions that are popping up about the Family First Act. My recommendation is to go grab it off the internet, read up on it. There are some stipulations about having fewer than 50 employees, but it doesn't make you exempt. So that's why you need to go and read it, okay? It's not like other regulations that if you have less than 50 employees that you become exempt. This one is written a little bit different right there. All right, so hope y'all have a wonderful weekend. Stay cool, stay safe, stay healthy, and I will see all of you very, very soon. Have a wonderful and blessed day, and make safe choices. Bye, everybody.